Hello, this is Dr. Eric Bricker, and this is how health insurance works. Today we're going to talk about arthritis doctors. Now, arthritis is painful joints. Now, if you're having issues with painful knees, hands, hips, or sometimes even elbows or shoulders, then you might have arthritis. Now, it may be best for you to try a primary care physician first, which would be for an adult, either family practice or a general internist. Now, you may need to see a different type of doctor called an orthopedist, which is a bone surgeon. Well, why would you need to see an orthopedist instead of just a primary care physician? Well, if there was a history of an injury, whether it be a car crash or a sports injury, then the primary care physician may refer you to an orthopedist. If you have an abnormal X-ray or MRI showing joint damage, the primary care physician may refer you to the orthopedist. Or if just the treatment of the primary care physician is not working, they may refer you to the orthopedist. The key being is that orthopedists are surgeons, so they may want to operate. Next, the primary care physician may refer you to a rheumatologist instead. And rheumatologists are experts in inflammation. They're inflammation doctors. Now, the primary care doctor will typically refer you to a rheumatologist if you are having other symptoms in addition to the arthritis in the hands or in the knees or hips. Now, those other symptoms might be things like redness or swelling or headaches or rashes. There's a whole number of different symptoms that might make the primary care physician want you to go see a rheumatologist. Now, what are the advantages of seeing the primary care physician first? Well, one, you can be seen sooner typically. So oftentimes in order to see an orthopedist or a rheumatologist, it might be weeks until you can be seen. Not all the time, but sometimes. Next, the primary care physician will likely be less expensive. So you'll have to check with your insurance plan, but typically a primary care physician copay is about $25, whereas a specialist copay, like an orthopedist or a rheumatologist, is typically twice as much, or about $50. So, if you're having arthritis, that's how health insurance works.